Hey guys, it's Dr. Vic
and Dr. Beau.
And this video we want to talk a lot about what we do in the office when it comes to the whole right brain, left brain kind of communication that we've been talking about, right brain weakness or right brain strength. And in this video, it's just breaking down what that really looks like, having a deeper understanding of when you are a left brain dominant individual versus a right brain dominant individual. And what does that mean for you? What do you see? What do you experience? But more importantly, how does that affect your health? And what are the things we can do to change that? I know Dr. Beau here is going to dive in deep about the functions of right brain versus left brain and all that as we go into it.
Yeah, I mean, it's one of those things where, we've been kind of slowly integrating these things into the office. And so you may have been, whether you're doing what you think is some weird exercises, or you're seeing people, kind of go out there and on the vibration plates doing some of that stuff, and why, right? Every single one of us has one side of our brain that is just a little bit weaker than the other. And so what we're focused on is strengthening that weak side of your brain. And so when it comes to right brain versus left brain, right brain is going to be that emotional intelligence, right? Kind of how you're feeling, more kind of rely on gut instinct or how you're feeling. Typically, what we're going to see is that's going to be usually more dominant in females. And then you've got your left brain, so that's going to be your IQ. So you're going to rely more on things that maybe you're more focused on finances or statistics, things like that, less relying on that gut feeling. And that typically we're going to see more in males. And so but we don't want to just rely on male versus female. We also have all these new tests that we're going to be doing on you all to figure out which one is weak, which one is strong, so that we can specialize our exercises for you. And as we dive a little bit more into it, right brain, left brain, right? So right brain, it's going to be one of, again, EQ, but then also it also controls a lot of other things. So it's going to be responsible for attention, empathy, right? Things that are maybe not as routine based. So again, kind of more that just going with the gut feeling. Right brain versus left brain also control the immune system. Now, the right brain is going to be in control for kind of making sure the immune system doesn't go too far into effect or overactive, whereas the left brain is going to be making sure that immune system isn't underactive. So for instance, autoimmune diseases, right? We see this a lot more in females, which I just said typically are going to be right brain dominant. So right brain dominant or left brain weak, with that right brain controlling the overactiveness of that immune system. So if it's too high, if it's too overactive, then all of a sudden we're looking at some of those autoimmune diseases. So those are just some of the things that right brain, left brain control. We could talk about this for hours, but Dr. Vic, you want to highlight some of your favorite right brain, left brain, different types of things that we may be looking for?
Yeah, I mean, left brain, like you were saying, the immune system, that's like your killer part to your immune system. So people who have a left brain weakness, they will have more like sinus issues, they get sick a lot. Those are our kids that we'll see that'll have tons of antibiotics, tons of ear infections. Those are the kiddos that we'll see that when they get into the teenage years, they've already had 10, 15 bouts of antibiotics minimum. And so it's one of those things where when a kiddo has a left brain weakness, we know to try to help stimulate that as much as we possibly can to create more balance. Those are our ADHD kids, our ADD kids, our autistic kids, our sensory processing disorder kiddos. Those are those types of neurological deficits, is when they're too strong in the left brain and not enough of that right brain coming in, like you mentioned earlier about the attention, right? Right brain gives you a lot more attention. Left brain's that verbal side, that communication piece of what we, that language and understanding language, where right brain is more that nonverbal. It's more of that intuitive type of global, universal type of communication, where the left brain's going to be more that logical, what word you use, the choices of the word you use, and more in that systemic approach. Right brain, well, let me go back to left brain dominant again. That's going to be, again, more in males. That's going to be more common for blood pressure issues, more common for higher heart rates. That's more common in males that have left ventricular failure, known as congested heart failure. They'll have it on the left side of their heart because it's more dominant in males. What we'll see with that, males are more prone to strokes, Parkinson's, just to name a few conditions. As you mentioned earlier, right brain is going to be more, for women, it's going to be more of that respiratory side, higher respiratory rates, shallow breathing. But we'll also know things like, when it comes to the right side, we're also going to notice that in women's heart health, they're going to have more failures on the right side of the heart versus the left side because they have more lung involvement, where men don't. We have more blood pressure involvement. That's why men are more prone to strokes compared to women. But that doesn't mean women can't have strokes. Again, like we said, this is not a easy black and white, men and women, this is how it is. There's a good percentage to it, but that's why we have specialized testing that we do that's so simple. You'll laugh at us half the time when we're doing it, right?
Yeah.
Like marching in place with your eyes closed or looking like a zombie and things like that. But that gives us a lot of information to really know how the functional component of your brain's working so that we can have deeper understanding to the severity of where you are. And the beautiful thing about this that I get really excited about is that I don't need to know your symptoms at all. Like, we don't need to know that. We know it because we want to know your history. But when it comes to this testing, you're not going to have symptoms. Like, there's not like a cerebellar deficit on the right side. You're not going to know that you have that unless it's multiple sclerosis, unless it's a Parkinson or Parkinsonian type of condition. Other than that, you don't know you have that. And so it's kind of cool how we can find these things out early and be able to help. I mean, I can go all day on this. This is a passion of mine and Dr. Beau's. And, you know, mental health is another big one that plays a huge role. And like speech delays in kids, we see it more in males than we do in females. Kids are, girls are going to be more nonverbal. I mean, you want to chime into the whole learning aspect? I mean, I can go all day on this.
Yeah, I mean, I'm just kind of laughing as you're talking because there's just so many different avenues to go down. But really what it comes down to is when we're able to figure out exactly which one you are, which side of your brain is just, not that it's, necessarily not functioning well or anything like that, but just the other side of the brain is dominating over that weak one. And we want to build it up so there's a little bit more of that balance, even though balance isn't really ever a true term when it comes to neurological health, because one is always going to be, on, off, dominating. But we want to make sure there is, that nice kind of strength to both sides of your brain. And so once we're able to really nitpick you and figure out exactly which side you need to be strengthened on, that's when we can really dive in and kind of personalize these exercises so that you can get those results faster and faster. And that's really the whole goal of all of this is we want you guys to get results faster. We want to get results faster. And so we're adding in this neurological component to just really stimulate that certain side of the brain that's weak so that you can get those results faster, faster, and faster.
Yeah, and it's huge. I mean, and again, even with, just to get back onto right brain, left brain really quick, even with posture, women have a unique posture to them, most women, than men do. And again, it's right brain, left brain, and depending on what's firing versus not. Right brain's going to be the more bigger muscles, the more postural type of muscles control, where left brain's going to be the opposite of that. And so it's kind of interesting to see when we evaluate things and what we do. And everything that we do, once we find what weakness side you have, that's when we go ahead now and put a plan together. Our adjusting is, if you've been a patient in the office already, you know how the adjusting process, and it's the same thing. It's just a little bit of a tweak. If you're not a patient in the office yet and you're watching this video, we do a special technique, a unique technique that we utilize. It's an analysis, but one of the things is we'll adjust mainly on the opposite side of where the brain weakness is, because that's what stimulates that side of the brain. And so everything we do, everything we're going to focus on is going to be doing just that, so that we can really bring your health neurologically, brain-wise, and so much more to the highest level it can possibly be.
Yeah, I don't know. I think that's pretty good. It's interesting stuff, really. I mean, the brain, the nervous system, everything we do here is based on that, and it's super interesting. And so we're always learning. The second we learn something, if it's something we want to integrate, we get a rocking right away. So we've been working to slowly integrate this, and now we finally got our exam form finished, all the tests finished, and so now it's all in. And now we just go ahead and each and every single one of you are going to get tested over the next week or two, so we can decide right brain, left brain, and how we're going to just move forward with your care to give you the best care that we possibly can.
Yeah, and if you're a new patient, check out the PDFs below that we have shared with you, that you can understand right brain, what it controls, left brain, what it controls, what happens when the right brain's wrong versus the left brain being out of whack, and then also about when you have those weaknesses, what are some of the common symptoms that you see that we kind of talked about here today. And like I said, we use technology to back up everything we do. We use specific neurological testing. We look at the best medical research that's out there. I mean, Dr. Beau and myself are always learning and growing. We are patients too. We're looking for ways on how we can maximize our own lives to be the best version. And like he said, once we find something that is sound, when it's medically solid and the research is massively supporting it, we're going to go ahead and make a massive shift. We don't have no problem doing that in our office and in what we do on a day-to-day basis, because we want what's best not only for you guys but also for ourselves. and make sure that we're brain attuned, we're balanced as much as possible, and really thriving in every aspect of our lives.
Yeah, I mean, I know for Dr. Vic as well, we're just excited to get this going. It's an exciting little tweak, not a huge change, but just a tiny little tweak to the office. And we know I'm looking forward to getting started, seeing those awesome results happen even faster.
So thank you guys for checking out this video. Any questions you have, you can definitely email us. If you're on the website watching this, you can go to the contact page and send us a message to myself or Dr. Beau, and we're more than happy to answer any questions you have. But as always, I want to appreciate you guys, and until next time,
Be well.
live well.
The choice is yours.